In our previous lesson, we looked at conditions and diseases that are associated with the reproductive organs. Today, we will continue with the reproductive organs by discussing sexually transmitted diseases or infections. What do we mean when we say sexually transmitted diseases or infections? It is any disease that is transmitted by sexual contact, involving the transfer of body fluids. This is so because the microorganisms that cause these diseases cannot survive outside the body. Certain sexually transmitted diseases are referred to as venereal diseases. The two most common ones are syphilis and gonorrhea. Let us begin with syphilis. Let us look at the causative agent. It is a disease condition caused by spirochete bacterium called Treponema pallidum. Mode of transmission. It is transmitted through sexual intercourse with an infected person. Symptoms. The symptoms appear about 10 to 25 days after sexual contact with an infected person. The first sign of syphilis is usually a large but painless ulcer or sore. Often, the ulcer appears on the penis, that is in the case of males, or on the vulva in females. However, if it develops on the cervix, it may not be noticed. After 3 to 8 weeks, ulcer heals and it may seem that the disease is gone. In fact, the bacteria rather moves deeper into the body. 6 to 7 months later, it may produce signs of secondary syphilis. This stage of the disease is usually marked by skin rash and ulcer in the mouth or on the vulva. These ulcers are highly infectious. Even without treatment, the rash and the ulcers may disappear, but the bacteria remain in the body and can cause damage to the aorta, heart, bones, joints, and the central nervous system. Tertiary syphilis at this stage is known and may be accompanied by large ulcers on the legs or head, and in some cases, blindness, paralysis, and insanity. In a pregnant woman with syphilis, the bacteria can get across the placenta. The baby may thus become infected. 50% of infected babies are miscarried, that is, expelled from the uterus at an early stage, or stillborn, that is, born dead. The other 50% are born with congenital syphilis. Congenital means from birth. Children with congenital disease may show the signs of secondary syphilis in their first 2 years or sometimes later. Let us now look at how the disease is treated. In the early stages, the disease can be completely cured by a 4-day course of penicillin injections. Penicillin given to a pregnant woman may also kill any bacteria in her fetus. People who are allergic to penicillin can be given tetracycline or other drugs. It is important to treat both partners even though one of them may show no sign of the disease. An apparent healthy person who has been having sexual intercourse with someone diagnosed as having syphilis is very likely to have caught the disease unknowingly. That is why it is advisable that both partners are treated together. It is also advisable to wear a condom when having sexual intercourse with a person whose status is unknown to you. I would say simply avoid casual sex. Treatment of secondary and tertiary syphilis with penicillin is less effective. Some of the symptoms are often relieved, but the bacteria may remain in the body and the penicillin cannot repair the damaged heart, nerves, and bones. For this reason, it is essential to seek advice and treatment as soon as the disease is suspected. After a cure, the body does not develop any immunity to the disease. Let us now take a look at another STI, which is gonorrhea.